So, again, periodontal ligament part 4. Forget to forgetting series hashtag. So, what are the principal fibers in the periodontal ligament and what is their function? What are the principal fibers? So, principal fibers run a wavy course from the cementum to alveolar bone in various planes. So, principle that to talk about it maybe. Yeah, principal fibers run a wavy course from cementum to the bone. They run a wavy course in various planes. Okay. So what are the two fibrous components of periodontium? So we have the periodontal ligament and lamina propria of the gingiva, which have gingival group of fibers and form the fibrous component of the periodontium. So what are how are cementicles formed? Cementicles formed by So we have cementicles are formed by calcification of degenerated thrombosis of blood vessels. Then we have the spines of cementum and alveolar bone undergo something that is there. Then we had this thrombosis of blood vessels and degeneration of things. Is there 3 types? So we have the degenerated epithelial cell crusts. Yeah, degenerated epithelial cell crusts and Sharpie fibers. Then we have the thrombosis of blood vessels. Then we have the spicules of alveolar bone and cementum traumatically displaced. Yeah, the traumatical displacement of the spicules of cementum and alveolar bone. Spicules and alveolar bone. Yeah. Then you have the thrombosis. Then you have degenerated epithelial crusts, cell crusts, and Sharpie fibers. 3 things. So what are the functions of periodontal ligaments? Periodontal ligament have the functions can be classified into physical or support. Then you have nutritive, sensory, and homeostatic. Homeostatic or functional or developmental. Okay. Yeah. So what shape does the periodontal ligament resemble? So periodontal ligament resembles the shape of an hourglass, which is thinnest or narrowest at the middle third of the root and widening both apically and towards the cell crusts. Not cell crust, it is alveolar crust. Okay. Alveolar crust. Yeah. What are gingival fibers? Gingival fibers are found in gingival connective tissue. What else? And they are underlying what? They are underlying the junctional epithelium and crevicular epithelium. Crevicular epithelium and junctional epithelium, which plays an important role in maintaining the integrated supporting system. Crevicular and junction. Okay. What is the supportive function of periodontal ligament? So when I talk about the supportive function, they'll provide the attachment. Yeah. Then they help. They act as a shock absorber to the masticatory forces. Okay. Then transmitting the external forces or masticatory forces to the bone. Okay. Shock absorber. Yes. Then acting as shock absorber, transmitting the forces. Then maintaining the relationship between the gingiva and the tooth, proper relationship, and one more is there. What is there? Protect the vessels, and nerves from mechanical injury. So we have the transmitting, shock absorption, then the proper relationship, then you have protection of the blood vessels and nerves from masticatory forces. Mechanical injury, not masticatory forces, mechanical injury, protected. So what is collagen? Collagen is a high molecular weight protein which is attached to small, sugar molecules. To small number of, to which small number of sugars. Yeah, small number of sugars are attached. To which small number of sugars are attached. So what is tooth support and shock absorption explained? It is explained based on 3 theories. We have this tensile related some theories there. Then we have some vascular, that body fluids. Fluid is responsible for the tooth movement, like that. One theory is there, like 3 theories. It is the tooth support and shock absorption is actually explained on the basis of 3 theories. I don't know, like 3 theories, whatever it is. What are cementicles? Cementicles, their diameter ranges from 0.2 to 0.3 millimeter. That's the question. Yeah, it is in older individuals. Whatever. So, what is viscoelastic theory? Viscoelastic system theory of tooth support. This theory attributes the fact that the fluids are responsible for the tooth movement, tooth displacement, and this fibers only have a secondary role in it. That is, the displacement of tooth is largely controlled by fluid movements. Okay, yeah. Displacement of tooth is largely controlled by fluid movements, and fibers only have a secondary role. What is tensional theory of tooth support? Tensional theory of tooth support says that attributes to the role of principal fibers of periodontal ligament in attachment of a tooth to the bony socket. They attribute the role of principal fibers. Major role of principal fibers of the periodontal ligament supporting the tooth and transmitting forces to the bone. Also, we have transmitting forces to the bone. Their major role in what? Supporting the teeth. Their major role. Tensional theory. Viscoelastic system theory. This is answer. A major role in support the teeth and transmitting the masticatory forces to the bone. So, what is the function of apical group of fibers in the periodontal ligament? Apical group of fibers. What do they do in periodontal ligaments? Apical group of fibers. They resist forces of luxation and prevent tooth tipping. That is the function of apical fibers of periodontal ligament. They resist forces of luxation and prevent tooth tipping. What happens to the fibers of the periodontal ligament as the tooth erupts? They get incorporated into the cementicles and the alveolar bone. They get embedded in the cementum and alveolar bone, forming things. Okay, so what happens to the fibers of the periodontal ligament? Fibers of the periodontal ligament as they tooth erupts. They orient themselves in various characteristics planes. So fibers of the periodontal ligament, fibers of the periodontal ligaments. So yeah, fibers of the periodontal ligament. Fibers of the periodontal. So fibers of the periodontal ligament. So fibers of the periodontal ligament. What do they do? Align themselves, orient themselves in characteristic planes. That's what happens during tooth eruption. Okay, what is thixotropic theory of tooth support? Thixotropic. The thixotropic theory states that periodontal ligament has rheologic behavior of a rheologic behavior of a thixotrophic gel. So what is thixotrophic theory of tooth support? It says that the periodontal ligament have a rheological behavior of a thixotrophic. They have a rheological behavior of a thixotrophic gel. Okay. What is the average width of the periodontal ligament? Periodontal ligament. What is it? The average width of the periodontal ligament ranges from 0.15 to the average width of the periodontal ligament varies from 0.15 to 0.38 to 0.15 to so average width of the periodontal ligament varies from 0.15 to 0.38 millimeter. Okay. So what is the sensory function of periodontal ligaments? What is it? So we just what is it? So periodontal ligament through its nerves supply provides an efficient proprioceptive mechanism allowing for the sensing of even a grain of sand caught between the teeth. So what is the sensory function of periodontal? So they have periodontal ligament through its nerve supply. So periodontal ligament through its nerve supply form or provides an efficient proprioceptive mechanism allowing so through its nerves provides a proprioceptive mechanism allowing for the sensing of even a grain of rice. Okay, grain of sand. Yeah, grain of sand caught between the teeth. Proprioceptive mechanism through its nerve supply allowing for the sensing of even a grain of sand between the tooth. Caught between the tooth. So what are progenitor cells? Where are progenitor cells found in the periodontal ligament? Progenitor cells present in the periodontal ligament and have a perivascular location. So periodontal ligament, progenitor cells. Progenitor cells are found in where? Periodontal ligament, and they have a perivascular. They have what? They have a perivascular location. They have a perivascular location. What is the nutritive function of periodontal ligaments? So periodontal ligament transmit blood vessels. Periodontal ligament transmit blood vessels. What is the nutritive function? The periodontal ligament transmits blood vessels, which provides anabolites and remove catabolites from the cells of ligament, cementum, and alveolar bone, with particular importance for avascular cementum. So what is the vascular function? Nutritive function of periodontal ligaments. So the periodontal ligament transmit blood vessels, so which provide anabolites and remove catabolites from the ligaments, cementum and alveolar bone, with particular importance to avascular cementum. So where is the periodontal ligament? What is the periodontal ligament continuous with? Periodontal ligament continuous with maybe cementum. It's continuous with the so periodontal ligament is continuous with the gingival periodontal ligament. So periodontal ligament is continuous with gingival connective tissue above the alveolar crest. So periodontal ligaments is continuous with the gingival connective tissue above the alveolar crest. So how are cementicles formed? Cementicles are formed by what? By the thrombosis of blood vessels and the spines of cementum and the alveolar bone undergo something, and the degeneration of degeneration of epithelial cell rest and Sharpie's fibers, and associated with cementum and alveolar bone. Something happens with the spines. Spicules of or spicules. So we have spicules of alveolar bone and cementum traumatically displaced. Traumatically displaced. Spicules of alveolar bone and cementum traumatically displaced. What are the cellular components of periodontal ligaments? Cellular components: osteoblast, cementoblast, all the blasts, osteoblast, cementoblast, fibroblast, cementoclasts, osteoclasts, progenitor cells. What else? Synthetic cells and resorptive cells of various structural components of the periodontium. So what are the cellular components of the periodontium? Synthetic cells. Yeah, they include this. Synthetic cells and resorptive cells of various structural components of the synthetic cells. So synthetic cells and resorptive cells are various structural components of the periodontium. So what are the principal fibers in the periodontium and what is their function? So we will say they form a wavy course from cementum to alveolar bone. Across different planes. In various planes. Yeah. So what are epithelial cell rest of molasses found? Where are the epithelial cell rests of molasses found in the periodontal ligaments? Found in the epithelial cell rests of molasses are found in the periodontal ligament close to cementum. So epithelial cell rests of molasses are found in the periodontal ligament close to what? Cementum. What is the supportive function of periodontal ligaments? So, about supportive function. They provide attachment. That is there. Yeah. Then they have the shock absorption. Yeah. Then transmitting the forces. Yes. Then protecting the blood vessels and nerves. Yes. Then maintaining proper relationship between gingiva and the teeth. Root of the teeth. Proper relationship between gingiva and the tooth. That's it. So what is the orientation of oblique fibers in the periodontal ligaments? Oblique. Maybe. What is it? Yeah. Oblique fibers have an oblique orientation. Oblique fibers. So oblique fibers have an oblique orientation. Oblique fibers have an oblique orientation within the periodontal space. What else? Yeah. What is the homeostatic function of periodontal ligaments? Like it may be associated with fibroblast actually producing collagen and also degenerating them by secreting enzymes. So periodontal ligaments have synthetic cells and resorptive cells of various structures responsible for structures. Okay. Responsible for maintaining the homeostasis of the periodontal tissues. Okay. By regulating the amount and composition of the extracellular matrix. So, what is the homeostatic function? So, they have resorptive cells and the synthetic cells which maintain the homeostasis of the periodontal tissue by regulating the amount and composition. Of the extracellular matrix. By regulating the amount and composition of the extracellular matrix. Yeah. What is the periodicity of collagen fibers? What is it? Collagen fibers have transverse striations. So, what is the periodicity of collagen fibers? Collagen fibers have transverse striations. with a characteristic periodicity of 64 nanometers. So collagen fibers have a transverse. So collagen fibers have a transverse striation. So collagen fibers have a transverse striation with a characteristic periodicity of 64 nanometer. Collagen fibers have a characteristic periodicity of 65 nanometer. They have transverse striations. So what is tensional theory of, so yeah, the principal fibers is actually responsible for providing the attributes the major role, providing support to the teeth and transmitting the masticatory forces to the bone. What are macrophages? Macrophages are like phagocytic cells. Are scavenger cells with a round or ovoid shape and a horseshoe or kidney shaped nucleus. So they have an ovoid or round shape with horseshoe or kidney shaped nucleus. Derived from what? Blood monocytes, yeah, and usually located near blood vessels. Derived from blood monocytes and usually located near blood vessels. So what are macrophages? So when you talk about macrophages are what? Scavenger cells with a round or ovoid shape with kidney or what are some other shape? Yeah, kidney shaped, horseshoe shape. Yeah, whatever. Kidney shaped or horseshoe shape. Derived from the blood monocytes. They are found near the blood vessels. What is the average width of periodontal ligaments? 0.15 to 0.38 millimeter. So average width is 0.15 to 0.38 millimeter. What happens to the fibers of the periodontal ligament? They orient themselves in various characteristic planes. Yeah, what is collagen? Collagen is a high molecular weight protein to which small number of sugar are attached. So what are progenitor cells found present? They are present in the periodontal. The progenitor cells are found in the periodontal space. Okay. Or periodontal ligament. Progenitor cells are found in periodontal ligament, closed cement. No. Progenitor cells have a perivascular location. So progenitor cells are present in periodontal ligaments and they have a perivascular location. What is thixotrophics? Thixotrophic theory says that periodontal ligament have rheological properties similar to that of a thixotrophic substance or fluid. Have a rheological behavior of a thixotrophic gel. Yeah, thixotrophic gel. It's a gel. Okay, gel. Yeah, so thixotrophic theory states that the periodontal ligament have a rheological behavior of a thixotrophic gel. So what is the sensory function of periodontal ligament? So periodontal ligament have sensory nerve fibers that form it forms a system which help in sensing even a grain of sand present between the teeth. They forms through its nerve supply forms a proprioceptive mechanism. Okay. So periodontal ligament through its periodontal ligament through its nerve. forms a proprioceptive mechanism which even senses a grayness and caught between the teeth. Proprioceptive.